out what to do with your life is hard. Figuring out what I want to do with my life, pretty much impossible. So I'm talking to people who actually have a clue. If that's you too, welcome. I'm your host, Sanvi, and this is Career Connect. We have with us our guest speaker today, Mr. Riney. Would you like to introduce yourself?
Sure, I'm Bob Riney. I'm the president and CEO of Henry Ford Health, and I'm happy to be here with you, Sanvi.
We're happy to have you here too. So let's start with the most basic question. What is your job? What does it have inside it?
So I am the CEO of Henry Ford Health, which means ultimately I have responsibility for 51,000 employees. We're the second largest employer in the state of Michigan, and 550 sites of care that include everything from hospitals to clinics, and really ultimately making sure that we're providing the support for our team members so that they can meet our community's health needs in every way that they expect us to be there for them.
That's a lot of people you're responsible for.
It is.
It seems like a lot of pressure. How do you handle that?
I gave up a long time ago trying to remember everyone by name, but I pride myself in being very relationship centered. I think no matter how small or large of a company you work for, it's about relationships, and so I'd like to say that I keep a line of sight. I travel a lot to our sites. I do a lot of video messaging. I do a lot of communication. And I think people want to work for companies and for people that are relatable.
Right.
And so I just spend a lot of time making sure that I am transparent, that people see me as direct and honest, and hopefully a little inspiring.
Yeah, I think building trust is really important, right?
Building trust is key. And, building trust is not getting everyone to agree with you. That's a mistake people make. Building trust means that people know that you're going to tell them the honest truth, that you're going to listen to whatever their ideas or concerns are with curiosity, and that you're going to explain the rationale behind decisions that you make. That's trust. It's not about getting everyone on your side.
Yeah. So what does a day in your life look like right now as the CEO?
Yeah, like the old saying goes, meetings, meetings, meetings. I do end up in a lot of meetings, but I really make sure that there's a purpose and an objective for every meeting, because we can get caught up in just meeting for the sake of meeting. But, a typical day for me is checking in with my executive team about how we're doing, what barriers we're facing. And then I do a lot in my role of representing Henry Ford Health outside of the health system. So I sit on a lot of boards in Detroit and in the state and in a couple nationally. And that's all around making sure that people know that we want to meet their needs, that we're available for them, and advancing other critical issues that are important to the state. So, for example, we can provide the best physical health, but it's not going to matter if we don't have great academic health, great economic health. And so I get involved in a lot of things that are education related, how to make sure the economy of Michigan is still advancing, because it all relates to health.
It's like holistic?
It's a very holistic use. And in fact, holistic is one of my favorite words, because it's how we approach medicine. Even though hospitals are the center, if you will, of attention in healthcare, and they do incredible work in very, very challenging circumstances, the reality is that healthcare, only about 11% of what affects people's overall health is done in a hospital. Most of it is what's done at home, helping them with leading a healthy life, educating them, having access for outpatient care. So you have to take a holistic approach. And by the way, helping them in other aspects of their work and life, because if they go home and have no access to healthy food, then they're going to be right back in our emergency room days later.
So it's about making healthy choices too, right? So as a CEO, would you say your main role is to look over or supervise the company?
I would say that my main role is to make sure that our strategies are the right strategies to take the company or the organization where we need to take it. But of course, you can't have successful strategies if you don't have the right people leading them. So it's about making sure we have the right talent and then making sure that that talent is focused on strategies and then ultimately being accountable for what we deliver.
Yeah. So after high school, let's look at your education. So what colleges did you go to? What degrees did you get?
So that's an interesting path for me because my degrees are from Wayne State University, and I was originally heading into either criminal law.
Criminal law.
Or I was going to head into business. Healthcare was really not on my radar screen. But an interesting thing happens if you're curious. The truth of the matter is I was a Wayne State student broke, like most students at that time. I was living off Wayne State's campus long before it was cool to do so. And I needed a job. I needed a job to help pay my bills, and I wanted something I could walk potentially to. So I found a post for a job that was called building specialist, and it was an afternoon shift job at Henry Ford Hospital. And I thought, this is perfect. It's afternoons. I can do my education in the day. I got the job, and the job, although it had that fancy title, I was actually security and receptionist in the student nurses dormitory, where all the student nurses lived that were in our programs. And a couple things came from that are really important. One is, even though that was my job, I started reading all the information that came out from the hospital. And I started talking to people that were passing in and out of the building that came from different roles within the hospital. And I discovered that healthcare is this fascinating mix of business, social cause. It's messy. It's highly regulated. It's very, very challenging. And all these things started percolating with me, and I thought, this kind of an industry checks all the boxes. I mean, I can be in a business, because it is a business, but it's got an incredible mission to it. The work is so important. You get to surround yourself by really smart people every day. I mean, the intellectual capability is unbelievable. And, doctors would stop by and talk to me on their way out, and I'd find out a little bit more. So to make a long story long, I ended up finding out that healthcare was a perfect environment for me. And 47 years later, to serve now as the CEO of this organization is unbelievable, because the first third of my career was in human resources. I did hiring, I did recruiting, I did dispute resolution, benefit design. The second third of my career was operations and working in different hospitals that we had. And then the final third was in executive roles. And now I'm in my fourth year as CEO of the enterprise. And so I really tell young people, as much as you may know that there's a specific track you're interested in, and that's great if you do, stay curious, stay open-minded. The organizations or industries that you may think are narrow may be quite wide once you take a look inside. And then I have to tell you a little light story that I've been wonderfully partnered with my wife, Sandy, for 43 years now, and she was a student nurse in that building when I started working there, and that's how we met. And she was also a student at Wayne State herself. So, I could have never penciled this out this way. I could have never predicted this, but I stayed curious, and I always wanted to learn about not just the job I was doing, but the next job, the job that was after that. And it's worked really well for me.
Yeah, I mean, so you were torn between all these different professions, and then you walked into healthcare and you see that it's this all-encompassing field, right?
It is, and I like messy. I mean, some people are real black and white thinkers. They want to work in environments where the rules are super clear and the roles are super clear and the responsibilities are super clear. And that's great. I love navigating gray matter. I love working problem solving that there isn't a single solution for. And healthcare with, its complexity and with all the advances is one of those enterprises. I am so glad. I don't know whether I found healthcare or healthcare found me, but either way, it was the perfect choice for me.
Yeah. So, I mean, you after college, you took a post at this building specialist, right?
Yeah, and then I went into HR.
HR.
Yeah.
So like I thought that to be a CEO of a healthcare company, you had to be a doctor. Is that not the case?
No, and that's one of the many misconceptions about healthcare. People think that it's if you want to be a doctor, you want to be a nurse. But the reality is healthcare systems are like cities. I mean, you have finance people that have to be very well versed in everything from audit, compliance, financial planning, reimbursement, billing. You have human resources that has all the complexity of 51,000 team members and everything that goes with that. We have people that do marketing and public relations. We have people that do process improvement and design engineering. We have people that work in sales and marketing. We have people that work in insurance. And then, of course, we have every kind of healthcare role you could think of. And so are there doctors that are CEOs? Absolutely. There's some phenomenal ones, but there are nurses that are CEOs. There's finance people. There's all sorts of things, because at the end of the day, it's skills are skills, but what really elevate a person to being a CEO is the ability to integrate all those skills, to be a relationship-centered person, to know how to deal with the multitude of different styles and personalities that come into every environment. That's not a college curriculum. That's a life experience. And it is really what is going to be a determinant of success more so than what actual classes you took.
Yeah. So what kind of people would thrive in your job, you say? What traits
It's
are
a good
needed?
question. Yeah, it's a good question. First of all, people that have a capacity to juggle a lot of balls at one time.
Work under pressure?
Yeah, really work under pressure. And know when to not overreact or underreact to situations. People that are very comfortable in the public eye. Because when you elevate to roles like this, especially in today's social media world, everything about you is sort of known. And now we got to worry about stuff that's actually made up with AI. So, you have to be comfortable being out there. You have to be able to inspire people. And I tell people that doesn't mean you have to be a great spokesperson, but you have to be able to inspire people through storytelling in whatever style suits you. As a not-for-profit organization, we have to rely on donors in part to help us advance medicine. So I have to be able to make a case to a donor of why we should be their number one choice. So I think it's having a personality that can inspire. It's having a true love for the diversity of all people. And I say love. You can't just say, yeah, I like diversity. No, you have to love diversity, because healthcare treats every single demographic on the planet. I think you have to know how to combine business with community good and not look at it as an either or, but a both and. So I think if you have a desire to give back, but you're also comfortable with the business side and having to make decisions that aren't going to always make you popular, it's a good role. And so I tell people, if you like gray matter, you like problem solving, you like figuring out the hard puzzles, not the easy puzzles, it's a good fit.
Yeah. I mean, and this day and age, people are like always watching, right? So your education after high school, you took this building post. In short terms, can you tell us how you got from this building post to like this huge CEO?
What I will tell you is there were a couple of turning points for me that were really important. One is I ended up early in my human resource career of being in employee relations. And that is one of the greatest growth experience opportunities to become a leader, because employee relations, you're ultimately trying to negotiate or solve a problem. And often that problem is from two different people that have very different views of what happened or very different views of a situation. And so you have to learn to ultimately listen, be empathetic, but then ultimately make a decision based on what's in front of you and explain that decision in a way that hopefully people will understand. Well, that in essence is business. And so I never realized back when I was doing employee relations how well I was being prepared. And then the second opportunity I had that was a turning point is a mentor of mine and a former CEO of Henry Ford, a gentleman by the name of Gail Warden. He called me into his office one day, and this is still when I was in HR, and he said, I see something in you that I really like, and I want to send you to Harvard for a very special, intense program they have on negotiation. And I went to that, and it was very impactful because it was about negotiation of people, negotiation of product, negotiation in the broadest sense of the word. And it was very intense. It wasn't a classroom lecture. It was very interactional. You were giving a role. And that was very impactful for me as well. And then I always tell people that, I was not a full-time nerd in high school. I was probably part-time athlete, part-time nerd, part-time worker. But the nerd part in me, the reason I say that is I ended up joining the debate club and ended up doing very, very well at a state level in debate. And I look back now and I think that was more developmental than I ever realized, because there's a theme in what I'm sharing, and it's all about being able to dissect complex things and get people to understand the path forward. And debate taught me a lot about that. So, and guess what? I talked to two other CEOs in healthcare. They both ranked high in state debate in high school. So all of a sudden I found this common theme of, not exclusive, obviously, but people that were drawn to debate, and that it helped them advance.
Yeah, I mean, actually, I am on my high school's debate, public speaking team too. It's crazy.
These experiences at any age that push you out of your comfort zone. I speak all over the country now, and there was a time I would have so much anxiety when I had to do, public speaking that, I couldn't tell myself then that I would be so comfortable now. But I knew that anytime one pushes themselves out of their comfort zone, good things happen.
Yeah, you grow. And
you grow.
More importantly, you learn how to deal with compromise and differences in people. What would you say are the best parts of your job?
Hearing from patients about how the care impacted them and their family members. And obviously, we're not a perfect organization. No organizations are. So I get some complaint letters, and I deal with those from a continuous improvement. But the ones where I get a lot of them to say, I was at my most vulnerable moment. I was never more scared than I've been in my whole life. And the nurse on this floor said this to me, and it calmed me down. And the physician said this, and the person delivering the food tray said, I'm praying for you. And those moments and the impact that those moments have, I love those letters, because you know what? It's not about anything I've done. It's about our team members. It's about what they do every day to help people at really, a lot of times their scariest moments in their life.
Yeah. What about the worst parts, though?
The worst part is really the challenge of doing all these things that are so important to society, and a lot of them not being reimbursed. So making the math work. As a nonprofit organization, we're we're $13 billion a year in operating revenue, but all money that we make above and beyond what we spend as a not-for-profit goes back into investing into the company, investing in our people, investing in new equipment. So making the math work is really, really difficult. Healthcare reimbursement is challenging, and yet we're a very expensive part of the nation's total cost structure.
Right.
So, we've got to both solve for that cost, but also recognize that if we're going to take a holistic approach, there's got to be an economic model to support that holistic approach. If a patient doesn't have any means to get to our clinic and we're paying for them to take a taxi or an Uber because we want them there, there's no reimbursement model that's mature enough yet to support that. But there's a movement for what's called value-based care, which means we're going to give a doctor X amount of dollars to take care of a patient, and there's going to be some risk to that, but it encourages the doctors and the health systems to spend dollars in the holistic way. So if it means investing in food for that person because it's going to be less trips to the emergency room, it's going to be a good thing in the end result. But this is all new, and it's counterintuitive to a lot of traditional business models. So we're finding our way there, but it's fun work, and it brings me joy.
Yeah, I mean, figuring out how to balance it all does sound hard. If a high schooler wanted your job, what should they be doing like right now, you'd say?
Certainly I think that, the academic, well, first of all, they need to decide whether they want to be a caregiver, because if they want to be a physician or a nurse and then ultimately a executive, they need to make sure that their clinical programs are solid. But as I said, there's many paths to get to be a CEO. So I think that, getting the academic preparation is kind of table stakes. That's an important part. But internships and mentors and experiential kind of learning is really what makes a difference. I tell people that, don't be freaked out if you don't know what you want to be. Be freaked out if you're not in a learning journey to figure that out. Because sometimes people know exactly what they want to do, and sometimes it's more of a learning of what you don't want to do that discovers what there really is out there. And that's really true in healthcare. So, experiential experiences, volunteer in a healthcare, start reading periodicals so you understand the pressure points that the industry is feeling. When you're there as a patient, talk to caregivers and say, what do you like? What challenges you the most? What's a great way for me to get involved? Be curious. I'm going to go back to that word. People like to help people that are on a journey to figure things out. And so curiosity is that main driver. And I would last say, make sure that you're getting experiences in life, whether it's debate or other things, where you're testing your ability to juggle. Because if you're more comfortable with, I like to focus on one thing and do that one thing, and that's how I'm at my best, and there's nothing wrong with that, then, I would say there might be some roles in healthcare that are appropriate, but a lot that wouldn't be.
Yeah. To close this episode off, I'm going to ask you one word to describe your job.
Impactful.
Impactful? Why?
Because every decision we make ultimately affects people's lives. If we make a mistake, someone could really suffer. If we provide a person with a bad experience, it could stop them from seeking health care that they need. If we provide somebody with a great experience, they're going to be so connected to their care that they're going to become a partner. And so impact is a big issue. I don't know all 51,000 members of our team. But I know that if they chose Henry Ford Health to work at, that they're special people and that they're drawn to making a difference. And so I want to make sure that in making decisions that are tough, you have to make budgets work, you have to open places, sometimes you have to close places. But it's always with the intent of taking care of our people.
Right. And I think with that, we conclude our third episode of Career Connect. I want to thank you for being here today with us, Mr. Riney.
I want to thank you because you showed a lot of fortitude in just reaching out directly and making the case for why you wanted to talk to me. And that's already a great, great thing.
Right. And I know that you have your own podcast, The Bobcast.
I do. I'm a big fan of podcasts, both as a learner and just a person enjoying them. I like some for fun. I like some for learning. But I do have a podcast. It's called The Bobcast, and you can find it on Spotify or YouTube. And I'm interviewing some really cool leaders about their own journeys. And I think for students that are curious and want to understand what makes a good leader, I encourage you to tune in. You're going to get different perspectives. I interviewed Dan Gilbert, and I'll tell you that when you listen to that one, he offered such incredible insight as to his own journey. So I think people enjoy it.
Yeah, and I love that you're showing that podcasting is still relevant even in your field. I mean, giving insights is so important.
And it's a great way to learn.
Yeah. So if this episode helped you figure out something, share it with a friend who's still figuring out some things out. And make sure to follow us on Instagram as Career Connect. Until next time, viewers, tune in every month to help discover your dream career and how to get there. Career Connect out.